Welcome, everyone, to the People's Health Briefing, a key component of our Trusted Voices campaign. I'm Dr. Noha Avalada from Roots Community Health, reporting for the week of April 7th, 2025. As health professionals rooted in Oakland, serving some of the most marginalized communities in California, we're here to cut through the noise and bring you the latest information on health issues relevant to us all. This week is the 30th anniversary of National Public Health Week, an initiative to recognize public health workers and highlight issues important to our community's health. And this year's theme is It Starts Here. So we love this theme. It's health equity, advocacy, climate change, the future of public health, all start with you and with our communities. And at Roots Community Health, we believe that the people closest to the problem should have the most power in the situation. And as an individual, you should have the most power over your health and your health care. As a community member, you should have the most power over issues that impact your community. And you're already taking action by watching the People's Health Briefing and educating yourself on health issues that our communities face. So I encourage you to take this week to go to the Roots Community Health website, rootscommunityhealth.org, and follow us on socials at Roots Empowers and the National Public Health Week website to see how you can become more involved in your community's health initiatives and health advocacy. And some of the specific calls to action from National Public Health Week include voting for health equity, so supporting leaders and policies that address systemic health inequities, engaging in dialogue, so encourage those conversations with friends and neighbors about health and about health equity, and champion access to care. And this includes, as we've talked about many times here, advocating for telehealth and other inclusive healthcare services in your community. So really appreciate all of this effort on this 30-year anniversary of National Public Health Week. And now, as promised, I wanted to share a little bit from the 2024 briefing survey that many of you participated in. Thank you once again for taking your time to provide your thoughts. There were several very helpful insights, so I'll just share a couple of those with you today. First off, in terms of the content that you all want to hear, number one by far was transmissible communicable diseases. And then second and third, which were pretty closely tied with each other, were food safety and chronic disease. And then fourth was mental health or behavioral health. And also of some interest was health advocacy, as well as nutrition and healthy lifestyle, and community violence and general public health education came in last. And in terms of the content type that was of most interest, the latest data and graphs on what is happening now also came in first by far. And then this was followed by health and public health advice and guidance, then in-depth reviews of new research articles, followed by Public Health 101. And of less interest was health advocacy, resources, benefits, and global health updates. So we really appreciate the feedback and suggestions and positive reinforcement. Your input helps us to do better and to stay motivated as we face a number of challenges together. And remember, you can always email your suggestions or your questions or your thoughts or your feedback to admin@rootscommunityhealth.org. In today's briefing, after respiratory virus update, I'll provide an update on measles and on pertussis. So starting off with respiratory viruses among patients who present to a healthcare setting for testing, we are seeing flu cases in the bright blue continuing to come down nicely. And as the percentage of flu comes down, some others are making up a larger share, like rhinovirus enterovirus in the gray, which we can see coming up, and human metapneumovirus in the black. A little harder to see at the bottom. In yellow is parainfluenza virus. Several others are looking relatively flat, just small movement. So as we head into a time where flu is coming down, RSV is coming down, COVID more or less stable at the moment, we're getting to that area where folks who are getting sick with respiratory symptoms may have one of the more run-of-the-mill cold viruses for which we don't have specific treatments. And of course, one of the primary reasons why we like to know if someone has COVID or flu, if possible, is because we can get specific treatment to them. So I still think it's important, especially for those at risks of a bad outcome from the acute illness, to be paying attention. If you get symptoms, get tested early. This will also help to ensure that you stay away from others until you're no longer contagious, and that does vary depending on what it is that you have. So even though there is still flu and RSV out there, we are getting towards the end of the season for those two viruses. But with SARS-CoV-2, we anticipate an increase in cases at some point in the coming weeks to months, just based on what we've experienced in prior years. And we know that there is pre-symptomatic transmission with SARS-CoV-2. We know that SARS-CoV-2 is highly contagious. So we see super spreaders, which we don't really see with the other viruses. So in general, it's good for us to know what it is that we're primarily dealing with in our environment, and in particular, when the risk of SARS-CoV-2 exposure starts to go up. And for some people, this may even help them decide about the levels of precautions or risks that they want to take in various settings. Now, that is not something that I can advise doing per se, because we all know good and well, it only takes one positive person to come near you or to share air with you. And this is especially possible in settings of poor indoor ventilation, where you and perhaps many others would end up with COVID from just one positive person being in the space. And that positive person could be pre-symptomatic. They could not know that they have COVID, but still be spreading it. So this is definitely one of the most frustrating things about SARS-CoV-2. But I also know that everyone has a different appetite for risk, different levels of precautions that they want to take. And I know that some of you out there are trying to time things like doctor's appointments or travel or other activities around times when SARS-CoV-2 activity might be lower. And some of us just like to keep an eye on what is going on out here to be informed. So for those reasons, I think the best bet right now, while things are relatively in a slower period with SARS-CoV-2, would be to take a look at some of the earlier indicators, especially if you can see where they are close to home or close to where you'll be traveling. And those earlier indicators can be found on the respiratory virus activity levels page on the CDC website. And there are a number of things we might want to look at on this page to get a sense of where things are going in our area. So first off is the level of respiratory illness activity. This was the previously named influenza-like illness, but during the pandemic, this definitely got broadened so that we can really get a fuller picture of what's going on with respiratory illness activities, whether it is from the flu or from COVID or from just one of those common cold viruses, pretty much all the viruses we just looked at. And this will give us a sense of how much of these respiratory illnesses are sending folks to the emergency department. And so this is a very different picture in, let's say, some of these states here in the Southeast or New Mexico or Nebraska, where the respiratory illness levels are very low, considered very low, as compared to some of these states like Wisconsin or New Hampshire or Maryland, where we can see that the levels are considered moderate. So this is just something to consider, because this is letting us know about how much respiratory illness activity is sending people to the emergency room. And of course, we know wastewater is a good early indicator. If you have sewer sheds near you that are reporting, you might be able to get a little more specific. Otherwise, this is still on the state level, but still there's some variation. So it's something that can be helpful, especially as things begin to change. So we can see that there are some states that are considered high, and there are some states that are considered very low. So this may be something to keep an eye on, or if you're traveling somewhere, it just might give you a little bit of insight. And we can also take a look at influenza and RSV for those as well. Next, taking a look at emergency department visits, and we can see that all three, COVID, influenza, and RSV, with those specific diagnoses, are each coming down, which is helpful and a little different from that broader definition that we saw on the first map. And of course, we expect influenza and RSV to continue coming down until next so-called respiratory virus season, so kind of sometime in the fall, whereas COVID-19, based on our experience, will likely come up before then. We just don't know exactly when, so that's why this may be something of interest to be keeping an eye on, and we'll continue to do that. And so for this, you can also take a look at your state, which might be helpful. So here in California, it looks pretty much like the rest of the country, but again, you can take a look at your state and see what direction things are heading. And so if you're wanting to know what is going on in your state, so for looking at California, then we might look at all of these. We might say, okay, this is the level of all the respiratory illnesses, sending folks to the emergency room. But if we want to specifically know what's going on with SARS-CoV-2, what direction things are heading, then we can look at that. And same thing with emergency department visits. And the epidemic trends map is something I think is interesting to take a look at, because this is using modeling to put together an overall picture of the direction that things are going. So it kind of takes all of the above, does some modeling, and gives us a sense of the way things are heading. And so this is showing us that actually the entire country, as it relates to COVID-19, based upon modeling, is either not changing, which is the gray, or likely declining, or declining. And so that is great news overall. Unfortunately, there are some states that aren't doing this estimating. So if you're there, unfortunately, it might be difficult, or you may need to look at some things on your state public health department website if they're sharing those things. But this is helpful and can give us a sense of the direction things are going. And you can also look at influenza, which even more of the country is declining, which is great. Not sure what's going on here in Maryland, where it's likely growing, but if you're in that area, that may be something to take a look at. And now taking a look at hospitalizations from the main three respiratory viruses causing illness: flu, COVID, and RSV. And we can see that flu, the blue line, continues coming down. It's getting very close to the orange line, which is COVID. And we expect that to keep coming down and likely cross below COVID in the coming weeks. So the worst of the flu season seems to be behind us. This does not change the fact that we're still seeing flu cases, hospitalizations, and deaths, but we can expect all those to continue going down from here for the season. But so far this flu season, we've seen about 45 million flu illnesses, 580,000 flu hospitalizations, and 25,000 flu deaths, including 168 pediatric deaths. So this is, of course, devastating to have this many deaths in general, but also to have lost 168 children. The main risk factor for flu death among these children is not being vaccinated. So we want to, of course, prevent every vaccine preventable death, but especially among children who are supposed to have a whole life ahead of them. And even though we don't have the specific data from this season yet about vaccine protection, we know that in general, about 80 to 90% of those who die from the flu are not vaccinated. So we lost a lot of people this flu season. The worst does seem to be behind us, but we are already thinking about how to do a better job next season and every season in the future, in terms of making the flu vaccine available and accessible, making good information available and accessible, in the hopes that in the future we can prevent as many of these tragedies as possible. And when we look at deaths from the three respiratory illnesses, looking out towards the right, we can see that flu deaths in the blue have exceeded COVID deaths in the orange for a couple of months now. And this happened for the first time in the entire pandemic, the week ending January 25th this year, 2025. And it has been happening each week from then through March 22nd. So that's 7 weeks plus the 2 preliminary weeks that are shaded in gray there. So likely 9 weeks thus far where we've had more flu deaths than COVID deaths. And we can see that right now, both flu and COVID deaths are coming down. So that is good news overall. And at this point, we will be monitoring to see if and when COVID starts heading back up. And I only say if because I'm still hopeful that we can keep improving in terms of limiting COVID deaths. We know that there are a lot of COVID cases, but we need to do more to prevent COVID deaths. And I'm really hoping that we will continue to improve year over year in that regard. It is still early in the grand scheme of things. So a lot of room for improvement and hopeful that we'll continue to do that. So when we take a look at the number of COVID deaths, they're currently declining. We hope to see this trend continue, but there were at least 576 COVID deaths the week ending March 8th. So that is lagging behind about a month. But since we saw that emergency department visits and hospitalizations with COVID have been coming down at least through the end of March, it's fair to assume that deaths will continue to decline behind that as well. So overall, we are in a better place, but still over 2,000 people dying every month in the United States from a single infectious agent, SARS-CoV-2. It's quite a lot. We still have a lot of work to do here. And the most important things I think we can do are first, make indoors safer for everyone. So we should be implementing healthy building best practices, especially improving ventilation, that exchange of air, also filtration, masking, testing, isolating, and so on. Secondly, staying up to date on vaccination, particularly important for those 65 and up, as well as those with immunocompromise. And in those groups, up to date means about every 6 months. So this is the recommendation right now. And then everybody else, the recommendation is every year. And then last but not least, timely testing and treatment. The window of time to get started with treatment is short. So we got to know that this is what we're treating. So as soon as you start to have symptoms, good idea to get tested. These are the treatment choices and the age groups and the window of time that you have to get it started. Very difficult to get the high titer convalescent plasma. So if you are immunocompromised and if you, for any reason, can't take the Paxlovid or other treatments, this is something to get arranged ahead of time. So you'll have a plan and you'll know exactly what it is you need to do. Are you getting remdesivir? Are you getting convalescent plasma? What is the plan? Because if you're severely immunocompromised, you are at the greatest risk, and we have to be thinking about this ahead of time. And now for a brief update on H5N1. So we've had no new human cases detected in the United States since I reported last week. So we're still at 70 human cases. And in addition to ongoing targeted testing efforts, there have been about 4,000 more flu tests conducted through the National Flu Surveillance System since I reported last week. And those are tests that would have detected H5N1 if it was present. There has been one death in the United States from H5N1 so far, and that was in the state of Louisiana. Remember that the gentleman who died in Louisiana had the same variety of H5N1. It had a particular mutation on it, the same one that caused a young girl in Canada to become critically ill. She did survive, but after a very prolonged ICU course and a lot of invasive treatments to keep her alive. And right now, the current only update that we have from H5N1 is that unfortunately Mexico is reporting its first human case in this outbreak, and it isn't a 3-year-old girl who's reportedly hospitalized in a serious condition. So very concerned about this. We're waiting to find out more. In particular, we're waiting for serotyping. So we want to get that sequencing so that we can learn more about the specific H5N1 that has sickened this child. So does it harbor the same mutations as the virus in the other 2 serious cases that we've seen? So we will report back as we have additional information. Until then, it's still the case that the main risk to humans is to those working with cattle or poultry, but still important to understand all the potential risks as we know them. So avoid consuming raw milk and raw milk products or undercooked meat. Do not touch any wild birds or dead animals. Keep your pets from doing this if possible. Definitely keep your babies, your children from doing this. And those working with cattle or poultry need accurate health information, proper PPE, and up-to-date information on their industry standards or guidelines. And now some sad news to share regarding the ongoing United States measles outbreak. An 8-year-old child has died. This is the second child death in Texas and in this outbreak, and these are the first measles deaths in this country in decades. The cause of this child's death is measles pulmonary failure. That is the most common reason why children with measles die, is from measles pneumonia and pulmonary failure. 1 in 20 children who get measles will get pneumonia. The outbreak that began in West Texas has now spread to multiple counties in Texas, as well as neighboring New Mexico, as well as Oklahoma, and even to Mexico. So now we have international spread from this outbreak that started in Texas. The information that is reported on the CDC website, unfortunately, they're still only reporting this page or updating this page once a week. So hopefully they will go to more frequent updating, as they often will when we're in a dire situation like this. But so far, or at least since April 3rd, there have been 607 confirmed cases. 12% of them have been hospitalized, so 74 hospitalizations. And 93% of these are outbreak associated. I'll talk more about that in a moment. There have actually been now 3 deaths. So once again, this third death came in after the CDC page was updated, but the Texas Department of Health did report that 8-year-old died from measles. And last year, for the entire year, 2024, there were 285 cases. So in the first quarter of 2025, we've already hit more than double the number of cases that we saw for the entire year of 2024. So we're really headed in the wrong direction fast, and there is no indication that it is slowing down. As I said, 74 individuals have been hospitalized at least, and there have been 3 deaths, so 2 children, 1 adult. And I mentioned that it's notable that 93% of the cases, so 567 out of the 607 cases so far this year, are outbreak associated. So by comparison, in 2024, under 70% were outbreak associated. So what's happening now is that measles is establishing itself with lots of local transmission, which means that we really are in a precarious situation here, an unpredictable situation. And in particular, areas with low vaccination levels are at high risk. But of course, many individuals throughout many communities are going to be at risk regardless of the vaccination rates, because, or despite the vaccination rates, even if they're high, because of spread that's being allowed to happen and cases being imported everywhere. And if you're someone who, for whatever reason, couldn't get the MMR vaccine or did not mount a good response, or you're in that 3% of people who just didn't develop antibodies after MMR, may not even know that that is the case. We are really putting all of this to the test right now. But at this point, we know that there is an increased risk, more so than we've seen in decades in this country. And this outbreak is definitely hitting young people. We have seen so far in 2025 that 72% of cases are in children 0 to 19. So that's those first 2 bars added together. So 72% in children. And looking at children 0 to 5, these are the young people that are at the greatest risk of a bad outcome. Their immune systems just are not developed yet. And even if they got the first dose, sometimes they won't have had the second dose yet, because that is usually given from 4 to 6 years of age. But even if they've had the vaccine, the 1 dose, they still have some exposure. But definitely these children who have not been vaccinated at all, and they're this little, they just don't have developed enough immune systems. And we're already seeing that 196 children, or about 1/3 of the cases in this outbreak so far, are in this age group of 0 to 5. Now, newborns will be protected by mom's antibodies if she has them for about the first 6 months of life. So if for whatever reason mom does not have protection, so never had the vaccine, never had measles, didn't mount a response, whatever the case may be, then baby also would not be protected for those first 6 months of life. Typically, we're not going to begin the vaccination until after 1 year of age. So most babies 6 months old until their first vaccination are very vulnerable. And then, of course, they don't get that second dose, like I mentioned, until they're 4 to 6 years old. So they're not fully protected until then. So this is something to just keep in mind. Again, babies 6 to 12 months are especially vulnerable, or really 6 months until they get their first vaccination. So if you're going to be traveling with them, if others are coming to visit the baby, please keep this in mind and keep them safe. If they are at risk of exposure, then you can consider giving a dose in that age range from 6 to 12 months, but keep in mind that they still will need to get the 2-dose series after they turn 1. And one of the challenges with measles is that it can take a week from exposure for symptoms to show up. And on top of that, even when the symptoms do show up, they can initially look like a number of things, because you get fever, cough, runny nose, fatigue, loss of appetite. So it won't necessarily be obvious initially, especially if you are not aware of exposure. And we are seeing that there could be exposures at the mall, at the airport. And so if you miss the memo, so to speak, then it's possible that you won't even know that you had an exposure. But within a few days of fever, that rash will appear, starts on the face, works its way down to the trunk, to the legs, to the feet. And in general, a person is the most contagious between 4 days before the onset of the rash to 4 days after the onset of the rash. So it's really going to be important to note the date that the rash began, because this is going to help us with our efforts to inform those who may have been exposed, and to also facilitate the quarantine, and of course to get medical help. Now, unfortunately, there is no antiviral treatment for measles, but if we know about it soon enough, we can try what's called post-exposure prophylaxis along with supportive care to try to improve the outcome. So timely testing and treatment if you suspect exposure or infection. And just a reminder that measles can lead to respiratory failure, brain inflammation, so encephalitis, which can lead to permanent brain damage, blindness, deafness. We say that it causes death in 1 to 3 per 1,000. Even with the best medical care, we're seeing a little higher than that right now. We've seen 3 deaths out of about 600 confirmed cases. So this does seem to be a little bit on the higher side, because 1 to 3 in 1,000 means that even on the higher side, that would be about 1 in 333. Whereas what we're seeing now is more like 1 in every 200. So the numbers are still small, all things considered, to be drawing conclusions about the fatality rates and things like that, but it still is a little more than expected. So hard to say whether this is a trend that we need to be concerned about. It's not clear to me if this is true, if this does hold, that we're seeing a higher case fatality rate, then it's not clear to me why this would be happening, other than perhaps what I pointed out earlier about this outbreak seeming to impact children. The numbers in terms of children 0 to 5 and certainly under 19 are disproportionate, especially in the state of Texas, even compared to some of the other states. And which is also where, in Texas is also where we saw the 2 pediatric deaths. So that's just a little bit of speculation on my part, based on knowing that children are at greater risk of a severe outcome from measles, and particularly all these young unvaccinated children. Of course, there are other possibilities. For example, it's possible that overall cases are being underreported, which would mean that the 600 number was the undercount, which means that the fatality rate would be overestimated. But I'm not familiar with any particular reason to believe that we're undercounting cases now compared to in the past. On the contrary, we are aware that there's an outbreak in progress and folks are working on it, but that is a possibility. Also, it could be possible that because of the same distrust of the medical system that has led to under vaccination in some of these communities, that people are just not seeking care in a timely fashion. And by the time that they do, it's just too late for the post-exposure prophylaxis or other life-saving supportive treatment. So we just don't know the answers to these things at the moment. What we do know is that these deaths are vaccine preventable. These hospitalizations are vaccine preventable. These infections, for the most part, are vaccine preventable. And all of these issues and complications that some of these children will undoubtedly experience are all vaccine preventable. But clearly, some parents are making a different choice. And these choices are frankly being egged on by some of the same disinformation agents that are also responsible for unnecessary COVID deaths. And there just doesn't seem to be any end in sight, not only to this outbreak, but also to the spread of deadly disinformation, because at this point, that it goes to the highest levels of government. And so we'll continue to do our best to stay informed and to disseminate accurate information. Unfortunately, I think we are going to be bracing ourselves and preparing ourselves for this situation to get worse before it gets better. Because remember, it's not only about the acute measles and all the potential complications that can come from the measles infection itself, but measles also wipes out parts of the immune system, making people more susceptible to other infections on top of the measles and up to a year or more after the measles. So this is really sending us in the wrong direction. And in other news and examples of heading in the wrong direction, I wanted to provide an update on pertussis, also known as 100-day cough. And that is because we have unfortunately seen the sad news that 2 infants have died of pertussis in the state of Louisiana. Cases are going up nationally, similar issues under vaccination. But to have 2 deaths in the state when there have not actually been any deaths in Louisiana since 2018, and cases are already getting close to what they saw in the state for the entire year of 2024. So again, a similar theme here of heading in the wrong direction. Now, pertussis is called whooping cough because it makes a very distinct whooping sound when a person who has it coughs, and it can last for months, which is why it's also known as a 100-day cough. It can be especially life-threatening for little ones, 6 months and under. So for healthy adults, it's mostly just terribly uncomfortable. You can even bruise or break ribs, vomit from coughing so hard. But it's really the babies that are at greatest risk of a severe outcome, including death. So please do keep this in mind. If you're going around babies that are 6 months and under, their immunity would come from their mom, who hopefully when she was pregnant got the Tdap vaccine. It's to be given in the latter part of pregnancy, so between 27 and 36 weeks. Mom should be getting the Tdap vaccine, but also the baby should be getting the DTaP series. It is a 5-dose series starting at 2 months of age. And then in adolescence and in adulthood, there are also boosters. So the pertussis immunity from the vaccine is not great. We've heard some promising news of some more durable, longer lasting vaccines, but it's also the case that most people who get it in adolescence, high school, young adults, and things like that will do okay. It's really the babies that we're worried about, just like we've seen with these 2 deaths in the state of Louisiana. And you may recall the news that in the state of Louisiana, their state surgeon general has basically said that the public health department is not going to be promoting vaccines. They're not going to be doing vaccination campaigns. They're not going to be doing flu vaccine clinics and COVID vaccine clinics like they have in the past. They're just going to hands off with talking about vaccines. So it's a bit baffling for a public health department to be doing such a thing. I'm not saying it's related, but the death of the one death from H5N1 was in the state of Louisiana. These 2 infant deaths are in the state of Louisiana. And one thing about the state of Louisiana is that there are high levels of poverty. And so to say that the public health department is no longer going to uphold a duty to ensure that especially marginalized populations have access to vaccines and that we're just going to have them just rely on their doctor, even though they may not have good access to a physician, is really just mind-boggling. And unfortunately, I think this is a sign of things to come. It's already happening. It's already underway. So this is definitely devastating. The fact that we have babies dying of vaccine preventable illnesses because of decisions to not get vaccinated is failure. It is an absolute sign of failure. That is what we are displaying already so early in 2025 with leadership that seems to be reinforcing and really stewarding this failure and really has been at the forefront of these activities for quite a long time before getting into a position of power. And so this is all very unfortunate. And I think that we are all going to have to continue to do the best that we can to keep ourselves informed, keep our loved ones informed, make sure that we are continuing to spread good information and keep ourselves and our loved ones as safe and healthy as possible. And if you don't have a primary care provider, I think if anything that I've said has underscored the need for this, it is that there will be places where public health will be taking a step back from their duties. I feel very grateful to be in the state of California, but we know that in many states in the United States that public health departments will not be putting out good messaging. They may be even putting out bad messaging, and they may also be withdrawing access to resources that are needed to keep you healthy. And so please try to get a primary care provider, develop a relationship with them before you need them. Make sure you're getting the appropriate screenings and vaccinations based on your age and risk factors. You are entitled to be healthy. You are entitled to have power within the type of healthcare that you're getting. And of course, try to do all the things we know can preserve your health and well-being, like eating a balanced diet, quit smoking, avoid alcohol and sugars, and limit processed foods and artificial ingredients. If you don't feel well, make sure you get your rest. Otherwise, get some regular physical activity, get some fresh air, manage those stress levels, and get a good night's sleep. This concludes today's People's Health Briefing. Thank you so much for joining us, and we'll see you next Tuesday at 10 a.m.